left has a 4-year-old daughter, Lucy, who is their middle child, who's been diagnosed with a metabolic disorder, and she is enrolled in hospice currently. Regina Holliday is a mother of a special needs child. She's a widow, an artist, and a speaker who focuses on healthcare. She has a real interest in data access as it relates to patient choice. Her husband had kidney cancer at the age of 38, had 2 children at the time, was hospitalized when he found out about that, and she'll tell you a little bit more about his experience and his end of life. And then finally, Michelle DeMeo, who is a health expert and also an artist and autistic as well. She's here on behalf of anyone who deserves hospice and palliative care as a choice, and I think she would cast a pretty wide net for people who deserve that kind of care. Michelle has what you may have heard called Lou Gehrig's disease. It's amyotrophic lateral sclerosis, so it's a progressive neuromuscular disease, and she's currently enrolled in hospice. So they've all joined us today to tell you, as only they can, what's really important for people who are seriously ill and approaching end of life. So I wanted to start with a question to our panelists. What advice would you give to healthcare providers about speaking to patients and their families about life-threatening illness? And I'm going to pass the microphone over so that you can hear them. We can start with Al.
Is that okay? Thanks, John. Our daughter received her diagnosis when she was about 6 months old. We didn't know until she was about 4 months old that she was ill, that there was any problem. Our diagnosis and those conversations, I think actually were handled really very well. There were a couple of things we would like to have heard differently, but to your question directly, the most important thing for us was that our physicians were honest and direct. We knew immediately how serious this was. As soon as they knew how serious it was, we did. Nobody was trying to protect us from anything. And of course it was devastating, but it was good that we knew what we were talking about. So that dimension of the communication at that point from the beginning, and you know, some different bombs dropping, the nature of the seriousness and prognosis and so forth. But at each point, each of those difficult moments was a matter of directness and honesty and an openness, a sense that there was time to answer our questions, all of the questions.
Great, thanks, Al.
Unfortunately, I had the polar opposite experience of that. My husband was a professor at American University, and he had 2 little kids, and he had been suffering pain for 6 months. We had been going to doctor's appointments consistently for many, many weeks until finally I demanded an MRI, and he we got one, and he gave the results to his doctor, and she called us 4 days after getting the CD and said she'd like to make an appointment with us to make an appointment with an oncologist. And I had no background in medicine, I didn't know what that was. And so I found out online that means a cancer doctor. And he was hospitalized for tests. And we thought he just had pain, and this is that you can leave a patient alone in a hospital and they're going to be fine. And I went back to work and I went to take care of my children. And 2 days later I got a phone call from my husband, and he is crying because the doctor's been in his room and said that he has tumors and growths throughout his abdomen and a tumor in his kidney, and he's so frightened and he doesn't understand what's going on. So can I please get there as soon as possible? And I did. I left my work and I got there in 30 minutes. By the time I got there, the oncologist in charge of my husband's case had left town for a medical conference. He'd be gone for the next 4 days and inaccessible by phone or email. I would go all over that hospital asking questions about what was wrong with my husband, how far had this progressed, what was going to be done. And I started researching online because I wasn't getting a lot of answers. And when I researched online, I learned there's this word called palliative care. It sounded really nice because he hurt so bad. After several weeks of being told we were going to get surgery and we were going to get chemotherapy and we were going to get treatment, that cancer is something you can fight, and that young men with children should fight it. The doctor came in my room on a Saturday and said he was sending us home on a Dilaudid pump. Well, I had done my research, and we knew what that meant. He was sending us home to hospice care without even saying the words, without ever having the conversation. That day, taped to the side of my husband's bed were 5 questions. 5 questions that my husband could ask a man who was on extreme pain medication but still wasn't addressing a lot of his disease. Those 5 questions were, when am I going to get surgery? When am I going to get chemotherapy? And when am I going to get a walker so I can try to walk again? But the 4th question was, when am I going to get something called palliative care? We fought for transfer to another facility so we could get a second opinion. We went through the roller coaster of care where once again we're told he's young and he should fight. It wasn't until my husband was in rehab and hospitalized for blood transfusion before a doctor took me to the side and said, "Why isn't your husband in a hospice setting? He's in too much pain. It's okay to get help." But she had to go off her duty and she couldn't come to talk to my husband. So the person who went into that room to have that conversation was me. I had to talk to him about what was next. There's no one there because that conversation is not funded. And my husband agreed to go to hospice. And you know, it was the best thing we ever did. Because when he went to hospice, a man who could not eat, he could not sit up, he would stop talking, he was sleeping all the time. They thought he was going to die in 2 to 3 days. This man, he got 24 hours of care at Washington Home Hospice, and he could sit again, he could talk, he could see his children, and he could eat, because his pain was not being managed. We got 4 more weeks of quality life due to hospice.
Thank you, Regina. Thank you. Michelle?
Hi, my story's probably, can you hear me okay?
Yeah.
My story's probably a blend of the two. I certainly knew what hospice and palliative care was. And I certainly knew what different medical diagnoses there were out there. I knew I was sick, probably, forgive my forgetfulness here, probably 2 years before an actual diagnosis. Because I was a very active kayaker, hiker, and such, and I found it odd that painting with a paintbrush was too heavy. And I ignored it for several months until October of 2010. I went to a rheumatologist who said, "Oh, your fibromyalgia, lose weight and get on fibromyalgia medicine." I said, "Well, I'm only here because I'm having trouble swallowing and breathing now, and those aren't signs of fibromyalgia." Make a long story short, I saw a series of other doctors that just said, "No, fibromyalgia." I said, "I used, lose some weight." I said, "I'm large, but it's because I used to have muscles. My muscles are going away. There's something wrong with me." I did come across a neurologist who said, "Well, yeah, you've got something wrong with you, don't know what. Let's wait and see." He said, "But I do want you to go back to that gym because you said you were athletic. So, and you seem intelligent and you seem active. Get to that gym and you work out hard." Well, I did, and I ended up in respiratory failure. And the team of people around who said, This isn't fibromyalgia. She has a PFT a total pulmonary function of about 20% at the time. And they were talking about venting me with my partner. Now, I was diagnosed at a very well-known establishment, which I will refrain from saying. And I'm here because I recognized being transferred to this very well-known facility, I was going to be diagnosed with ALS or something like that. I had a collage of tests done. I could tell by their faces that they knew I was seriously ill. After the tests were done, the door opened. My partner was not asked to come in. And I saw in their faces, they gathered around me, 3 doctors. One of them just put his hand on my leg and said, with no emotion, "I'm sorry, you have motor neuron disease." Kind of patted me on the leg, got up and left. I sat there and I thought, I'm 37 years old. You're walking out the door. I knew ALS meant death. There is no cure. But it was a 2-minute conversation to say, you have motor neuron disease. And they walked out the door. I sat there, got my strength together, got dressed. And I knew intellectually I was going to die, but I wanted someone to tell me. And I saw one of the doctors in the hall, and I said, am I going to die? And he coldly just said, I'm afraid so. You need to get to an ALS clinic as soon as possible. Good luck to you. And that was that.
Thank you, Michelle. So I have a few more questions, and really, I think that each of you so poignantly shared your stories, and we thank you for that. Clearly, there is the theme, the thread continuing here around communication, that it needs to be done early, it needs to be done well, and it needs to include all of the options for care. So often in healthcare, what we hear when people have a serious diagnosis and maybe they've gone through treatment, what's presented to them is there's nothing more that can be done, therefore we're going to refer you to hospice. Hospice is a lot more that can be done, as is palliative care, which, as has been described, can occur much further upstream and help with communication, with symptom management, and with many of the issues that our speakers have been talking about.